Today we are going through a simple squat progression to help reduce anterior knee pain when squatting. This can include patellofemoral pain, osteoarthritis, Osgood-Schlatter irritation, patellar tendinopathy, and more. Quick note before we start, pain does not always mean damage, but pain is still a signal. During these exercises, aim for discomfort that stays mild and controlled. A good guideline is pain at or below a 3 out of 10 during the set, and it should settle back down shortly after you finish. If pain ramps up, your form breaks down, or symptoms linger into the next day, scale the range, reduce the load, or choose an easier variation. Here are the 4 squat progressions in order. Each one builds strength and confidence while keeping the knee in a more tolerable position. First up is the Spanish squat. This is one of the best starting points when squatting is painful, because the strap or band support lets you sit back while keeping the shin more upright. That often reduces the compressive stress and irritation at the front of the knee. It also gives you a strong quadricep stimulus without needing heavy weight, which is key for improving knee tolerance over time. You will need a thick band or a strap anchored behind you at knee height. Step into the band so it sits behind both knees, right at the crease behind the knee. Walk backwards until you feel the band pull your knees forward slightly. Feet are about shoulder width, toes slightly turned out if that feels natural. Now brace your core like you're about to be gently punched in the stomach. Sit your hips back as if you are lowering onto a chair and let the band support you. Keep your weight balanced through your whole foot with a slight emphasis through the midfoot and heel. Common mistakes to avoid are letting the knees cave in, leaning too far forward and turning it into a hip hinge, letting the heels pop up or dropping too low and losing control. For dosage, start with isometric holds. Try 3 to 5 sets of 20 to 45 seconds. Rest about 60 to 90 seconds between sets. If holds feel good, you can switch to slow reps. Try 3 sets of 8 to 12 reps with a 3-second lower. Brief pause and controlled rise. Next is the kettlebell counterbalance squat. This is one of the best ways to reintroduce the squat pattern when your knee does not like bodyweight squats yet. Holding a weight out in front acts as a counterbalance, which helps you stay upright, sit between your hips, and keep the squat smoother. This usually improves technique, reduces compensation, and makes it easier to find a pain-free range. It also begins building quad and hip strength through a more functional squat. Grab a light kettlebell, hold it by the horns, and extend it slightly in front of your chest. Stand with feet shoulder width. Take a breath in, brace your core, and begin to lower. Think about sliding straight down between your hips, not folding forward. Keep the kettlebell out in front as a guide to keep your torso tall. Let the knees travel forward only as much as needed, while still tracking over the middle toes. Keep the heels heavy on the floor. Pause briefly at the bottom, then drive up by pushing the floor away. Keep your ribs stacked over your pelvis so you do not flare your chest. Try 3 to 4 sets of 8 to 12 reps. Use a slow tempo. 2 to 3 seconds down, brief pause, then up with control. Keep the range of motion where pain stays mild and stable. Up next is the goblet squat. This is the next progression because it increases the load on the legs in a very joint-friendly way, while still helping you keep good posture. Goblet squats strengthen the quads, glutes, and adductors through a bigger range, and they train better control of knee alignment. For anterior knee pain, this helps build capacity so normal squatting, stairs, and sport movements feel more tolerable. Hold a dumbbell or kettlebell at your chest like you are holding a goblet. Elbows point down and slightly forward. Feet shoulder width, brace your core. Lower into your squat with control. Keep your torso tall and your eyes forward. Let the knees travel naturally, but keep them aligned over the second and third toes. Think about gently spreading the floor apart with your feet to prevent the knees from collapsing inward. Go to a depth you can own. If the front of the knee is cranky, shorten the range temporarily. You can also squat to a box or bench to keep the depth consistent. Pause for a moment at the bottom, then drive up through the midfoot and heel, squeezing the glutes at the top without leaning back. Try 3 to 5 sets of 6 to 10 reps, depending on how heavy you go. You should finish the set feeling challenged but in control. Keep the pain guideline in mind and progress either depth first or load first, not both at the same time. Last is the Bulgarian split squat. This is a powerful tool for anterior knee pain because it trains single leg control, which is where a lot of knee irritation shows up. It builds quad strength, glute strength, and hip stability. It also challenges the knee to tolerate load with good alignment. Many people with patellofemoral pain or patellar tendon pain need this single leg strength to return to running, jumping, and sport. Stand a couple feet in front of a box or bench. Place the top of your back foot on the box. Your front foot stays planted. Before you start, find your stance length. When you lower, you want the front heel to stay down, and the front knee to be able to track over the toes without pinching. Take a breath in and brace. Lower straight down, keeping your torso slightly forward, like a small athletic lean, not a fold. Keep most of your weight through the front leg. The back leg is supported, but the front leg is doing the work. As you lower, keep the front knee aligned over the middle toes. Do not let it cave inward. Go to a depth you can control. Pause briefly, then drive up by pushing through the front foot. Think about pulling yourself down under control, then pushing the floor away to come up. If the front of the knee feels irritated, try adjusting by shortening the range of motion, shifting your hips slightly back to keep the shin more vertical or using a support, like holding a wall or rack, to keep balance and reduce stress. For dosage, start with body weight. Try 3 sets of 6 to 10 reps per side. Then progress to holding dumbbells at your sides. Keep the tempo controlled, especially on the way down. Here is a simple way to use this progression. Pick the most tolerable variation and train it 2 to 4 days per week. If squatting is very painful right now, start with Spanish squat holds. Once you can tolerate that well, move into counterbalance squats, then goblet squats, then Bulgarian split squats for single leg strength. A good session could look like this. Spanish squat holds, 3 to 5 sets, then one squat pattern, 3 to 4 sets of controlled reps. Then your accessory work, like hip strengthening or calf work, if needed. And remember, the goal is not always zero pain sensation. The goal is building capacity so your knee tolerates squatting again. Try out these exercises to see your anterior knee pain improve and be able to squat pain-free.